ground. You held me down.
There and welcome. This is Joy 99.7 FM and this is Strong and Sassy. My name is Animwaa Anim-Addo and I'm so thankful to be doing this today with you. Thankful to God that we're here, but also thankful to you for choosing us because, of course, you could be anywhere else. So thank you. You can watch us on Facebook. You know, I always tell you that the visuals are better. You get to see the facial expressions and all of my beautiful guests. So if you're not driving, then maybe, just slide on over to Facebook and then you can be interactive as well. Our WhatsApp lines are open 05511119997. I'm announcing the WhatsApp lines because tonight's show is a very interactive show. I really want you to send in your questions and your thoughts. I know that you're going to have so many. So 05511119997. We're starting our Beauty in a Bottle series. And in this series, we're going to be talking about how it looks as if you can buy the way you look. Now, many years ago, things like Botox and fillers and all of those things they were like really far away, but now they're kind of like in our backyard. So if you have the money, then you can pretty much buy however you want to look. I think the best example of that is Kris Kardashian. If you've seen her pictures, I know she's in her late 60s. She looks 20 something. Amazing surgeons. So that's the Beauty in the Bottle series, and we're starting tonight. But tonight we're starting with weight loss. And weight loss is something that a lot of people have struggled with for so many years. Typical example is Oprah. We've all watched her over the years struggle with trying to lose weight, getting skinny, putting the weight back on, until quite recently where she's managed her weight and she talks about GLP-1 medications like Ozempic, Wegovy, Mounjaro, which I'm sure you've heard about. So we're starting from that point tonight. And joining on Strong and Sassy is Dr. Fatima Mohammed. She's a physician specialist at the Korle-Bu Teaching Hospital. Thank you, Doc, and welcome.
Thank you.
Thank you so much for being here. So, before we get into the details, I mean, what's your take on? I don't even know how to. What's your take on the current trend of these GLP-1 medications that a lot of people are using to lose weight?
Okay. So, first of all, we have different categories of, what I say, obesity. Okay. So, it's not everyone that we advise to use medical means to lose weight. When I mean medical means, I mean medication, surgery. So, we have people who have BMI above 25. We say they are simply overweight. And for those whose BMI is 30 and above, that's when we start talking about obesity.
Okay.
Yes. And if your BMI is above 25 and you don't have any other medical complications like diabetes, heart disease, or any metabolic problem that has to do with weight gain, then we would first off advise you to use diet and exercise to lose the weight. But if you have obesity, that's BMI above 30, then we could do the diet and exercise and probably add on, medications like you mentioned, the GLP-1 analogs like the Ozempic and the tirzepatide.
Yes. When you meet people who are overweight, they'll usually tell you a story of how they've battled it, for so many years. So it looks as if these drugs that are now on the market are almost like a lifesaver, a game changer. I think something that surprised me was when Serena Williams, talked about using, I think, Mounjaro. And like we all know Serena, she's a tennis pro, she's fit, she's complaining about
She's a sports
Yeah,
person.
yes,
Yes.
you know,
So
she's
we don't expect her
to
to
complain about,
struggle with weight gain. Yeah.
with weight gain. So what is it? I mean, if you could explain to us or help us to understand what is it, or how come sometimes our bodies get into a space where we are unable to just, follow diet and exercise and still lose weight.
Okay. So there are several causes, apart from, sedentary lifestyle. You're not exercising, you're not active. And for those who don't follow calories, carbs, fatty foods. Apart from these, there are other medical conditions. So for such people, so for instance, if you have someone who has obesity, and even with obesity, we have different categories. We have mild, we have moderate, and we have morbid obesity. We have to first investigate to make sure that there's no underlying problem, a problem that can be, managed. And surprisingly, for some of these people, when you are able to solve the medical problem, the weight just disappears.
Okay.
So one of such things is hypothyroidism.
Okay.
So we have something in our neck called the thyroid gland. It's supposed to release a hormone that keeps us active, increases your metabolism. We are unaware of it because it's working normally.
Okay.
When it's hyperactive, you tend to lose weight very quickly.
Okay.
So those people struggle with weight gain. They're actually very skinny. And when it's hyperactive, it's not, releasing a lot of hormone, or you are deficient in the hormone, then you tend to put on weight effortlessly. Even when you are not eating,
Okay.
you find that you are gaining weight. So for such people, for example, what we simply do is just to replace the hormone.
Okay.
Yes, so you have to take the thyroid hormone, the thyroxine, as levothyroxine every day. And then your weight, issues would be solved.
Okay.
Other things that can lead to weight gain is PCOS, polycystic ovarian syndrome. And for that one, there's a drug called metformin. It's been found to really help, with the insulin sensitivity. And over time, with exercise, you can lose the weight.
Yeah.
So it really depends on what we find. But for, most people who do not have any underlying medical problems, it could have to do with their hormones, especially for women, when we are nearing, menopause. When you get to, so there's this normal curve, of, hormonal change. So when you get to the age of 30, the peak production of estrogen and progesterone, that helps to keep your weight in check, and then after 30, yes, you still produce some estrogen and progesterone, and some little, amounts of testosterone.
Okay.
Yes. And when the testosterone levels really drop, this is the same for males as well. So you'd find that males above 30 start getting a little bit of a pot belly, no matter how hard they try. It's because their testosterone levels naturally fall.
Dropping, okay.
Yes. And that also increases our basal metabolism.
Okay.
So all these changes can make you gain weight after a certain age, even
Okay.
when you don't have any medical condition. Yes.
Okay. Okay.
Yeah.
So, I mean, with that background, enter, all of these GLP-1 medications.
Yeah.
What is it about these ones? Because over the years, they've been different. There was a time when there was phentermine, and there was a time when there was duramine. I think it's pretty much the same thing,
Yeah.
but packaged differently or
Yeah.
called differently. And there was always, like, a bit of some sort of hype around some of these weight loss medicines. It looks like they worked a little for a little bit. They had some of them had really persistent side effects. But then for the past, I think, year or 2 years, we've been hearing about these GLP-1
Yes.
medications. And of course, the arguments are crazy,
Yes.
especially if you are consulting on TikTok and and Instagram.
Yeah.
But what is different about these and the kind of results that these
People are
GLP-1
getting,
medications
yes.
are giving? Yes.
So the difference is that back then, the weight loss, medications that were marketed, some had to be pulled out of the market because of very severe side effects. And most of them worked by reducing or decreasing your total body water. So actually, when you actually weigh less, but it wasn't healthy weight loss.
It was water.
Yes.
Okay.
And most of these ones that are being marketed as herbal products, that's what mostly they do. They just decrease your total body water.
Okay.
Some also have very severe side effects like causing scarring in your lungs, called pulmonary fibrosis,
Oh, wow.
and that can make you dependent on oxygen for the rest of your life, which is really bad.
Yeah.
Yes, so they had to
yeah.
be withdrawn. And we also don't advise that you just walk and buy any weight loss product without checking the active ingredients. But the game changer has been the GLP-1 analogs. The reason being that GLP-1 is like a natural substance produced in our body. So it's not like you are introducing something foreign.
Okay.
It's like you are just enhancing what your body produces. Yeah, so what GLP-1s do is that they are naturally secreted, when you eat, to suppress your appetite. So when you are full, when you have a full stomach, you don't feel like eating more because GLP-1 is released. And it also goes to an organ in the abdomen called the pancreas to stimulate it to release insulin. And the insulin then decreases your blood sugar. Okay. And it also slows down the release of food from your stomach so that you don't get hungry quickly and then end up eating lots more food. So the GLP-1 analogs have almost the same structure as this naturally occurring GLP-1 in our bodies, and they work the same way as well. So initially it was discovered to manage diabetes, as I mentioned that it increases the insulin production, and so it helped diabetes patients. But they noticed that, well, look, some of them were really losing weight very quickly. So they applied to get it licensed as a weight loss drug as well. Yes. So the one that we use for the diabetes, the GLP-1 analogs, we have different types. So semaglutide is the commonest one. That's the Ozempic. Yes. But we have various. Wegovy is just like Ozempic, but a higher dose, and that's what is licensed for weight loss.
Okay.
Yes, but Ozempic is in the US, where it was first registered, is restricted to managing blood sugar.
Okay.
Yes, so if you are not diabetic, your insurance will probably not cover Ozempic. Yes.
Okay.
But you can, apply to use Wegovy for weight loss because it's been licensed to use. For Ozempic, you have to, Wegovy, for weight loss, you have to inject once a week. But there are others that you inject every day.
Okay.
And that, kind of creates a bit of an inconvenience. Yes, because people cannot picture themselves injecting every day.
Every day, yeah.
Yes, we also have the Rydellsis, which is the tablet form.
Oh, okay.
Yes,
I
it's
didn't
not
know
widely
that.
available, but it's there in the US.
Okay.
It's the same, molecule as the Ozempic and Wegovy, and it can also be taken.
Right.
Mounjaro is tirzepatide, which is also another type of GLP-1 analog. Comparatively, I think it's a bit cheaper than Wegovy.
Yeah, I think because
Yes.
the doses are higher.
Higher,
Yeah.
yes. And so generally they work. For people who have been on it, we reevaluate the patients after 3 months. We expect you to lose about 10% of your initial weight, and thereafter you are going to lose a total of 50% of your weight, target weight. I mean, let's say if you have morbid obesity and we want to you to lose about 10 kilograms, we expect that you should lose about 5 kilograms by your 6-month appointment,
Okay.
even if you are not exercising or dieting. But when you add exercise and diet, the rate of weight loss is even better. Yes.
Goes up.
Yeah.
So, I mean, we've seen a lot of success stories, whether it's TikTok, whether it's Instagram, whether it's Facebook,
Yeah.
but there's also a lot of I don't know if it's scaremongering. Sometimes you don't know whether the propaganda is internally generated because from the pharmaceutical companies, or whether it's just people hating or people
Yeah.
But I think one of the big issues is that I have heard about is pancreatitis. And you did mention that it stimulates, these GLP-1s are going to stimulate the pancreas to produce insulin. So should we worry, if somebody is thinking about getting on any of these GLP-1s, is that something to worry about?
I'd say that is not a very common side effect. For every drug that's produced, it goes through what we call clinical trials. So they first test it out in the lab, then they progress to animal studies, and then they translate it to humans. So when that was done, they picked up 1 or 2 cases of pancreatitis. But then when it was approved to be used, they also did some clinical, studies, experimental studies on patients to determine the number of those who would have pancreatitis. Yes, they did get 1 or 2 people who developed pancreatitis from the use of Ozempic, but they could not replicate that in other trials. Okay, so it's not a very strong evidence, but then we keep it at the back of our mind so that when someone comes with pancreatitis, we find out whether they are using Ozempic, and then we can take it away. But it's not something that frequently happens.
Okay.
Yeah.
So sometimes social media has a life of its own, because when I saw the pancreatitis and a couple of people sent it to me and stuff, I went online to try and find out what, and you read things about ibuprofen, about paracetamol, and so my arguments for this has always been that almost every drug has side effects.
Yeah.
But the thing is to consider, I guess maybe on an individual basis, whether this is going to help you more than it could possibly harm you.
Yeah.
And one thing that came up in a lot of the conversations is insulin resistance, and how people who have struggled with insulin resistance, will diet and will exercise and be in the gym and do keto and whole foods diets. There's whole foods diets, there's keto, there's Atkins, there's all of these things, and the weight is not shifting. So I think what we want to know is, how do we, Ghanaians, we would like self-diagnosis. So before we go to a doctor, we want to have an idea, of what's going on with us. So could you educate us a little bit about insulin resistance and what that shows up like?
Okay. So when we say insulin resistance, it means that normally our cells need glucose, to generate energy and to do all the other, functions. And this glucose has to enter through certain channels. I would explain it like a lock and key.
Okay.
So let's say that the glucose channel is the door, and it has a lock, and the insulin is the key that opens that lock. So if you don't have insulin, the door remains closed.
Okay.
And so you need the insulin to open the door, to allow the glucose to enter into the cells. And this insulin, sensitivity is improved when you exercise.
Okay.
Yes, when you exercise, certain chemicals are released in your body, the feel-good hormones, and some other substances that, upregulates. When we say upregulate, it means that it increases the number of locks on the door, such that you can open so many doors and then allow the glucose to enter the cells.
Okay.
When you have insulin resistance, it means that the number of locks, reduce, and some are even non-existent. So regardless of how much insulin you have, the glucose remains in the bloodstream. It doesn't get into the cells. And when you don't have insulin, you are still not able to process fat as well. Yes, so your lipolysis, your fat breakdown is also impaired, and that's why the weight loss is a bit more difficult when you have insulin resistance. Initially, insulin resistance can be managed with exercise, and if it's not responding to exercise, our go-to drug will be metformin, because that has been proven to increase insulin sensitivity. And then the GLP-1 analogs, apart from increasing the hormone, it also has some bit of insulin sensitivity as well.
So the GLP-1s, are they like the last stop?
No, they are not the last stop, because there are people who are on, as I said, there are some people who have what we call morbid obesity, and they have a lot of other metabolic complications. Some already have a stroke, some have very uncontrolled diabetes, heart diseases, all that in one person. So for those people, we have to take very drastic measures because, as I said, even the GLP-1 analogs, it takes a while.
Yeah.
After about 6 months or a year, and if you don't have that much time, then we have to go to the next step, which is the surgical
The surgical
management.
routes,
Yes.
Yeah.
And the surgical management, the non-invasive ones, are the intragastric balloon, where a balloon is
You
put
swallow.
through
that's
the
one that you
through the
swallow,
endoscope into your stomach, and then it's inflated. Yes, so it sits in your stomach, like occupying some space, makes you feel a bit fuller.
Fuller.
Yes, and it reduces the cavity size so that you eat less food, and that can lead to weight loss.
But that doesn't. So okay. With the balloon, it doesn't. You feel full.
Yeah.
But it doesn't necessarily decrease your appetite.
No.
So then the challenge is there. I think the unique selling point of the GLP-1s, and I've heard a lot of people talk about, is the food noise.
Yes.
It's just the not
feeling
like
full. Yes,
eating.
seeing whatever you like, and you don't feel like eating. Yeah, because it's a brain thing. It also works on the brain, the appetite centers. Yes.
So
to reduce the cravings and all that.
Yeah, and I think that's maybe one of the things that really stands out.
It does.
About the GLP-1.
It does.
And it's funny because I was asking then, that does it mean that for people who have maybe been overweight for most of their lives, is there a glitch somewhere in, I don't even know if it's like a stomach mind thing, where, because I was talking to a skinny person, and they didn't understand the concept of food noise. They couldn't relate to waking up in the morning and craving 5 different things, and your day kind of centering around you ordering this at this time, and just always wanting to eat.
Yes.
So where does that food noise come from?
Yes. So as part of the underlying medical conditions I was talking about, we have something we call there are some genetic things underlying obesity. So those who have genetic predispositions, we have people who have problems with some hormones, naturally occurring hormones, that are satiety hormones. We have 2 hormones that control appetite and satiety, leptin and ghrelin. Yes, so those who have mutations in these hormones may become obese. Yes.
Because they are
the hormone is, when you eat, the stomach distends and those hormones are released, and then they give a signal to the brain that you need to stop eating. So when you are full and those hormones are released, no matter what food is presented to you, even if it's your favorite, it just won't go down. But when you don't have, that feedback, and then you just keep eating uncontrollably, so you find that those people have terrible reflux because they just can't stop eating. And most of these people start becoming obese from childhood because it's a genetic problem. Yes. And secondly, there are people who have problems with not the satiety bit, but their metabolism. So they don't eat much relatively, but then they find themselves gaining weight faster than their peers.
Okay, because so I was speaking to a lady who is on the GLP-1 medication, and I was asking her about her long-term plan. For maintaining the weight, and she mentioned, she thought when she reached her target weight, then she would do some sort of gastric, so either a balloon or a gastric sleeve. But now I'm a bit concerned because I get that the balloon will make you feel full, but it doesn't address, so which means that it's actually possible to overeat still.
Well, there's no room to overeat, because
you'll throw up.
Yes, you throw up because it's basically just occupying, a chunk of your stomach, and the part that is available is where the food sits in, and so if you eat beyond that, it comes right back up.
Wow.
Yes.
So I guess if that happens a few times,
yes, you would have to advise yourself. The thing about it is it cannot be in there for too long. Right. It has to come out.
So a more permanent surgery would be the
gastric sleeve. Yes. There were other things we're doing, bariatric surgeries, but the side effects, sometimes can be troubling. So for those with morbid obesity, sometimes we recommend bariatric surgery in the past, But gastric sleeve, I would say, at the surgical bed is also a game changer.
Okay.
Yes, because unlike the bariatric surgery that comes with, diarrhea,
What's the bariatric? Yeah, bariatric surgery.
yes, so they cut off, part of your tummy
Okay.
just to reduce the size,
Okay.
and then join it with the first part of your intestine, which is the
Okay.
duodenum.
Okay.
Yes, so what happens is that because a part of your stomach has been cut off, every part of the stomach contributes something, so they come with some nutrient deficiencies because some parts of the stomach helps us to absorb, minerals like iron, vitamin B12, so they have those deficiencies. And also because the size has been reduced drastically, the food goes into the intestines too quickly.
Okay.
And when that happens, the food doesn't really go through the digestion needed in the stomach before going into the intestine. And so because of that, it causes release of water, fluid into the first part of the intestine, and that can lead to diarrhea.
Okay.
Yes. And sometimes it can also lead to very low insulin levels, because once food goes into your intestines, the insulin is released. So when food gets there too quickly, the insulin also gets released too quickly,
Okay.
and that can overwhelm your system and lead to hypoglycemia. So
Okay.
you find them having fainting spells,
Okay.
diarrhea, and all sorts of
That sounds
nutrient
like a lot,
deficiencies.
yeah.
Yes. And so most people end up, the regret is there. But with a gastric sleeve, it's like they follow the normal curvature of the stomach.
Okay.
So they are just taking,
Like pieces of everything.
yes, every
Everything is
part. So
reduced
every part is
proportionally.
intact, but it's still reduced.
Okay.
Yes.
Well, that
And
makes
so
much more
yes,
sense.
and so you don't lose your digestive function. You're still able to absorb some nutrients, and then the food gets digested well before it goes into the intestine.
But it makes your stomach smaller.
Smaller, yes.
So you can't eat.
Yes, so it removes about 70 to 85%.
Oh wow.
Yes, that drastic.
Okay.
Yeah.
So maybe I guess for maintenance, if you're thinking of the
Yes,
extremes,
long term. Then
long
is
term.
the gastric, sleeve.
the gastric sleeve.
Yes, but Ozempic has really, helped a lot of people.
But the question
Yeah.
that people always ask,
When
or the
you
question
stop,
that I ask, are
yes.
you going to be on it for life?
So, what we say is that it's buying you time to implement your lifestyle changes. That's for those who don't have underlying medical problems.
You know that the lifestyle changes.
Yes,
is
it's
not
hard
going
to do.
change.
Yes. So for those who go on exercise, there are some people who have, really problematic, weight gain that causes them pain in their knees, arthritis in their knees and in their ankles, and they cannot even exercise. So if you ask such a person to include exercise into their routine, it's practically
problem,
impossible.
yeah.
Yes. So you do the GLP-1s to the point where you can, carry yourself, you can do some level of physical activity and work on your diet. And I think it actually also trains your brain, because if over time, if the cravings
Have
and the
reduced
yes,
and you get used to a
exactly.
certain kind of eating.
Hopefully, yeah.
A friend of mine was on GLP-1, and
Okay.
this is in response to the training of the
Mhm.
brain, because she talked about the fact that you don't crave anything, you don't feel like eating anything, you don't you can actually make food decisions, so you can
Yeah.
decide that this is what you want to
Yeah.
eat. And then also the fact that it's almost like your body starts to tell you what it needs, so you'll have very specific cravings.
Things, yeah.
But at some point she was like, she's tired of just like, there's a certain joy that we get from eating,
Yeah.
especially social eating. And she said, she'll go out with her family or her friends, and it's like,
Yeah.
you know what I
It's
mean?
like it's flat.
It's everything. Yeah, everything is flat. You
I
can't
understand,
really
yeah.
taste, this or and so she was telling me that I think for about 2 or 3 weeks she just came off it so that she could just. And so she said after the second week, her appetite started to come back,
Picking
and
up,
in that
yeah.
1 week she really ate. And she really ate to the point where she was like, you know what? No, I'm just going to go back on this medication and
Yes.
stay, because
Yes.
we have maybe certain instincts or certain desires that don't go away necessarily.
Easily. Yeah.
Yes. So it can be quite easy to
Yeah.
put on the weight back once your
Yeah,
appetite.
so the researches that have been done followed up, people who have been on Ozempic for at least a year or two. And when they came off it, they noticed that about 70% of people got their appetite back,
Yeah.
and they were, back to the same
The
habits
same,
again.
yeah,
Yes.
yeah, yeah.
So that's the problem. I mean, if you can't keep taking it all the time, then it's a real challenge.
But
yeah.
it's really about habits.
Yes.
But also, so when you read up on the GLP-1, it talks about, apart from the food noise and all of that, it's almost like it helps your body be more efficient. So when you come off it, how do you keep that level of efficiency?
Yes. So as I mentioned, the trick
Please don't
about
say that it's an
yes,
exercise.
the trick about exercise is that you may not see, physical changes. As I said, everybody's body is different, and depending on your hormonal constitution and your genetic makeup, it may be more difficult to lose weight, than other people. But then what exercise can do for you, apart from the weight loss, is that it releases those same hormones that I spoke about
Okay.
that regulates your cravings and all that. Yes.
So then it kind of acts as a
It kind of acts like
as a
that.
substitute.
Yes.
There's another natural substitute that's been talked about a lot, berberine. Is that something that, if you don't want to go the chemical route necessarily, is that something that
Yeah, it also helps to reduce appetite and cravings.
Okay.
Yes. It's been used. But it's just that because it is a natural substitute, it's more of the homeopathic class than the,
okay.
and so we don't have so much research,
Because
back
it's a
in it.
natural,
Yes.
okay.
Yeah.
Right. There's a new GLP-1, I think that's coming out soon, or has come out in some retatrutide.
Yeah, it's a true type.
How different is that from, because according to the videos that I've seen, there's claiming that works even better than tirzepatide.
So it's more longer acting. It has to
Okay.
do with the length of time it would take. So maybe
wear
if
off.
yes. So as your friend said, when she stopped the Ozempic within a week or two,
Or
her
two, yeah,
appetite
yeah,
was
it was
back. But
back.
this one may take longer.
Okay, so
Yes.
that's the main difference.
That's the main difference.
Okay.
Yeah.
But it's not readily available.
No,
Not.
it's not yet. It's still going through the clinical trials.
The trials. Do you think that as a country we'll get to a place where these drugs are over the
Readily.
counter? Maybe we are producing. I mean, I know there's a lot of laws.
Yeah.
Those who have came up with it have done
Yeah.
their best to protect it so that it's not. I
Yeah.
think they're preventing
The
mass.
trademark, yeah, it's still so we don't have generics yet. I mean, other companies are not allowed to produce it
produce.
yet. Yes.
Yeah.
So I believe that when we start having the generics, that's when we
Do
would
you
see
think
an
that we
influx.
will be able to
Oh,
at
soon.
some
Every
point?
drug gets to that point. It
Yes,
may
sir.
take longer for Ozempic and then
Because it's
Mounjaro,
almost like
but it would happen. Yeah.
it's a crazy
yes.
revelation.
Phenomenon. Yeah.
Those who
Yes, so
discovered it
they have to, like, it's patented. It has to go on for, I don't know how long their contract term is, and when that expires, then they have to release the recipe or whatever chemical constitution.
Right. So it's a new
to-
thing, a new drug that was
Yes,
created.
it's been in. I mean, research shows that, like, back then, there have been research on GLP-1 analogs. It's just that no one was really able to put it into, like, a drug formulation. It's the natural one that was being studied and how it worked, on our appetites, on reducing food cravings and stimulating the release of insulin. But the synthetic one, the one made in the lab, is what came out as Ozempic and Wegovy.
And which is changing.
Yes, and even in the US, it's regulated.
Yeah.
I mean, you just can't walk in and buy.
And
buy
buy it.
Yes. So for Wegovy, if your doctor has to determine that you have that level of obesity that is either accompanied by a metabolic problem or it's just morbid obesity and they want you to lose weight really fast. You may find some people are just simply overweight using it because they have maybe either hypertension or fatty liver or something else. Yes.
So, I mean, if it's regulated everywhere, how come it's being sold in Ghana?
That's an interesting
How come
question.
it's being sold
Yes.
in Ghana?
So, I mean, you can make a case for yourself if you can prove that you are obese. You've been trying to lose weight with the diet and exercise and it's not working.
Okay.
Yes. So if you are simply obese and we've tried diet and exercise, our next step is to go medically
With the GLP-1.
with the GLP-1 analogs.
Right. So my concern is that a lot of people I know who are on it are doing it without
A doctor's supervision.
a doctor's supervision. So we are, prescribing it for ourselves, moving up doses, ourselves based on our own
How you
analysis
feel. Yeah.
and how we are seeing. What's the danger in that?
doing
You
that, yeah.
see that I think the problem is a friend of mine was like, oh, she wanted to, go on Mounjaro and her doctor says to start from 5 milligrams, and she was calculating how much it costs because it's very expensive
It is.
in Ghana. So, if she's going to do 3 months on 5 milligrams, then move to 10, why can't she just start with the 10 so that, the costs.
Yeah, it's probably because of the side effects. So the common ones are nausea, vomiting, diarrhea. If you have a combination of these three, you can actually be hospitalized
Yeah,
because the diarrhea can be really troublesome.
yeah.
Can lead to dehydration, acute kidney injury. So for every drug we start slow to see how your body responds.
Even when it's as expensive as these ones.
To see how your body, and it's not everybody, I forgot to mention, that can take Ozempic or anything in that class, because Mounjaro, Ozempic, Rydalsis, and Wegovy, they've been linked to medullary thyroid cancer.
Okay.
Yes. So if you have a family history of thyroid cancer,
Then
you are not allowed to use that. Yeah,
Okay.
that's the only time you're not allowed to use it.
Oh, okay.
And
okay.
the interesting thing is that where we are, most people wouldn't have the diagnosis. So you need to be careful.
When
yes.
you're doing.
And one of the complications is the development of that type of cancer.
Okay.
Yes.
Okay. Also, there's a phenomenon of slow responders. I think I saw that on TikTok.
Yes.
So people respond to the medication differently.
Mm-hmm.
What is it that makes some people better responders and some people slow responders?
Slow responders. Okay. So number one, I mentioned about the satiety hormones, leptin and ghrelin. So if you have a baseline defect in any of these hormones, you will not respond very well to the GLP-1 analogs. And also there are people whose pancreases have been depleted already. So for some people who already have diabetes, they may have type 2, which is when the insulin resistance happens. But over time, it can lead to depletion of the beta cells, what produces the insulin. So that part of the GLP function or action, where it stimulates the release of insulin, would not work because you don't even have the beta cells to begin with.
Okay.
So that is why some people may respond slowly than
so
others.
when they're slow responders, do you then get, if you're doing it under medical supervision, do you then get some sort of medical support, or do you just take your time for the medication to work?
So if you started at a lower dose, would probably step it up and then give it some time. And if you're still not responding, then we move on to the next modality, which may be surgical.
Okay.
Yes.
I've also seen some doctors on TikTok add other ways. So I think I don't remember his name, but he was talking about adding drugs like metformin to some of these GLP-1 medications. Is it because they have like different pathways of how they work?
Yes. So if you have, I think you asked about how to know if you have insulin resistance. Yes.
Yeah.
So for most people, apart from the obesity, they may have color changes in their skin. Okay, we call it acanthosis nigricans. So you have this dark patch on your neck, at the back of
Okay,
your neck, that
okay.
just doesn't go away.
Okay.
You know, you scrub it, use all sorts of
It
creams
doesn't go.
under your armpits, in your
Okay,
groin, that
okay.
doesn't go away.
Then I think the hump.
Yes.
There's the hump
Yes,
too.
there's also the hump there. So that's a sign of insulin
Insulin.
resistance.
And then the those little black. I don't know what they're called.
Yes.
I think
The moles.
yeah, the little mode. Those
Yes.
are all signs. Of,
Yes. And so if you have insulin resistance, your go-to drug will be metformin. We may add a GLP-1 analog as and when, but metformin has been shown to have a more stronger, you know, action on insulin sensitivity than the GLP-1 analogs.
Okay.
Yeah.
So that's why some doctors even then go to
Yes.
the point of
Yes.
combining.
And if you have polycystic PCOS, we would definitely do metformin in addition to something else. Yes.
Right. Okay. So I mean, all this goes to say that it's not something you should do on your own.
Yes. You need the supervision. Because when it doesn't work, when you reach a dead block, you'd have to go to the next step. Yeah. So you
And
need
you'll
someone
need-
to guide
But I'm
you.
sure
Yeah.
as doctors, you've had people walk in and say that, oh, I've been.
Yes.
I've
Yes.
maxed the
We
dose
see that
out,
all
so-
the time. We see that all the time. So then we have to take a proper history, see how you're using it, whether you're using it properly, the brand. Because even though it's still patented, I've seen some brands from Turkey, I've seen some, so I'm just wondering how that, came into being. But the people who use them say it works, so I have no reason to doubt.
There's no doubt that people have
Yes.
figured out.
Yes,
and
I have
they
no
will
reason
flood the
to
market
doubt,
with-
yes, that it really works. But we also need to pay attention to the brand that you're using, and whether it hasn't broken the cold chain, because there's a way it's supposed to be stored. Yes, so all that can affect the efficacy of the drug. Yes.
of the drug. Wow. Well, thank you so much. I think you've answered most of our questions. Okay, this one is from one of our listeners talking about when this weight loss is just about women. And yeah, most of the time when we're talking about weight loss, we're thinking about, but men and GLP-1s. I mean, is that a thing?
Yes. So actually, most of the patients we see, I mean, the women, I know we do it on our own, so we don't really come to the doctors. But most of those who will come, with uncontrolled diabetes, plus obesity, plus one metabolic complication, we start them on a GLP-1 analog.
Amen.
And it does wonders. Yes,
Wow.
it does.
Well, that's pretty
Yes.
amazing.
Yes.
There's also just quickly before you go, there's also the upside or the other effects of. I think I've read that with GLP-1s, there's the cardiac. It improves some
Yes,
sort of
yes,
cardiac.
yes.
Reduces Parkinson's, Alzheimer's.
It has numerous benefits. So, cardiovascular complications like stroke, heart problems, and some kidney problems.
But is that from the losing weight or from?
Not just from the losing weight, from the drug itself.
Okay.
It's action, yes.
Okay.
Plus, you get the add-on benefits of weight loss
Of
and,
weight
and the
loss.
other things, yes.
Okay. So I think that generally the people who are so against.
No, I think it's a good drug, but just speak to your doctor
Before
first.
you,
Yes.
yeah, like every other drug,
Yeah.
speak to your doctor. Don't self-medicate. So that's it for our show tonight. I hope that we've answered your questions on Monjaro and Wegovy and all of that. But like Doc said, speak to your doctor. Your doctor will be able to hook you up. If they prescribe it, I'm sure they'll have a way for you to get
Yeah.
it. Also, so that you're getting, like Doc said, the right brand, that has been stored properly, so that you're getting the maximum effects. Because we are aware that they're very, very, very expensive,
Yeah.
especially in Ghana, and our insurance systems are not really set up like other countries to do that. So I hope you enjoyed our first part of our Beauty in the Bottle series, talking about weight loss. Thank you so much for joining us. Thank you so much for being here.
Thank you for
Doc,
having
we
me.
really appreciate your time. My name is Animwaa Anim-Addo. You can rewatch the show on Facebook. If you have any questions, you can ask them under the live video, and we'll try our best to answer them from what Doc has said. In case you missed any part of it, if you need further clarification, please go to your doctor. Your doctor will be able to give you all the information you need. Thank you so much. A big thank you to the team. for all of the production and everything else. And we'll be back next week, God willing. Continuing with Beauty in a Bottle, probably talking about other things, Botox, fillers, hyaluronic acid, and all the ways that you can pay to change the way that you look. All right, then stay blessed, take care, good night, and thank you.
Joy 99.7 FM.